This is a case of Down syndrome. Down syndrome is the most common chromosomal anomaly in which the autosome is affected. We all know that our each somatic cell contains 23 pair of chromosome, out of which 22 is autosome and one pair is sex chromosome. That autosome, if we do karyotyping, that if we photograph the pair of chromosome in diplotin stage during the cell condensation phase, in metaphase arrest, with the help of colchicine we do karyotyping, then what we see, the 21 number of chromosome, if we arrange in the descending order of length in the chromosome, then 21st chromosome, when it get affected, there is 3 chromosome in spite of 2, that is trisomy 21, then it is known as Down syndrome. Here we see A to Z problem. There is so many problem. A to Z problem. A for atrial septal defect. What we see, that this is the heart of a Down syndrome patient in which there is a defect in the atrial, that is the in between the right atrium and the left atrium there is septum, atrial septal defect. This one is the atrial septal defect. Okay, and also A for Alzheimer disease. This patient most commonly affected by the Alzheimer disease. B for Brucefield spot. This is, just look at into his eye. Then this is the gray spot. The gray spot around in the iris is the Brucefield spot. Gray white spot in the iris. B. C for cognitive dysfunction, that it is severe mental retardation will be there. Then D for duodenal atresia. This you can see in green color. This is the duodenum, and here is tract is very much narrowed and sometimes it is blocked. So duodenal atresia. Okay. E for epicanthal fold. Just look at this eye, that there is canthus, inner canthus, outer canthus, but the inner canthus is overlapped by a skin fold. This is called epicanthal fold. So E for epicanthal fold found in the Down syndrome patient. E. F for flexible joint. Just look at this joint is so flexible. Okay, yes, every joint is very flexible. Okay, and also finger. F for finger. That's fifth finger. You can see that the little finger is very malformed, crooked finger will be there. Okay. E, F. G for gonadoblastoma. In the mosaic variety of the Down syndrome, mosaic variety in which there is a defect during the process of oogenesis. This Down syndrome occurs due to the defect in the cell division and cell division process, and if it is particularly during the oogenesis, when one cell get affected by the Down syndrome, in extra copy of the 21 chromosome is formed and many much cell formed of the same lineage of 21 trisomy type, then it is known as mosaic variety of the Down syndrome. It is more dangerous and in which there is gonadoblastoma. Just look at this gonad, there will be tumor over there, gonadoblastoma. G. H for hypotonia. The tone are very less. Okay, hypotonia. Okay, and also suffering with the hypothyroidism. Hypothyroidism. GHI, I for intelligent quotient. Its IQ level is 50. If compared to the normal person, IQ is 100, then comparatively is IQ is 50. Okay. J for joint, hyperflexible joint. Now J, A B C D E F G H I J K. K for crease. Although its spelling is CREASE, but not taking, this is only one palmar crease, one transverse palmar crease, that is known as the simian crease, and there is many crease in the plantar surface of the foot. Okay, and there is only one crease in the hand. So, and also there is kidney problems are there. Okay, as a KL, L for leukemia. This Down syndrome patient is 20 times more prone to leukemia. KLM. M for mishappened ear or slapped ear. Just look at the ear, they are look like just someone has slapped or mishappened ear. Okay, and M for also maternal age. Maternal age is very important because if the maternal age is 20 year and she's giving birth to a baby, then the chances of being Down syndrome is 1 is to 15,000. And if the maternal age is more than 35 year, then the chances of delivering the Down syndrome baby is 1 is to 25. Okay, now N, and there will be N for nape of the neck. Just back of the neck is known as nape of the neck. There is skin tags over the nape of the neck. Okay, and O for omphalocele. Omphalocele is the another name of the umbilical hernia. Just look at here. This is the umbilicus and the intestine is protruding out of the umbilicus, so it's suffering with the omphalocele. Okay, or umbilical hernia. OP, P for pneumonia infection, the pneumonia, lung infection, as well as the ear infection. P for pneumonia. Q is very clumsy letter, so it's signified the mosaic pattern. There is mosaic pattern, which I have already told. In case of mosaic pattern, there is in the defect during the oogenesis process and gonadoblastoma occur. In this mosaic pattern, there is also severely mentally retardation. Patient will be there. Okay, and O P Q R. R for Robertsonian translocation. In Robertsonian translocation, there will be acrocentric, in which the small base is there will be a small arm and the long arm in a chromosome, and when a small arm is broken off and it will lead to the trisomy 21, then it is known as Robertsonian translocation. The severity in this is low, but this is it is suffering with a familial tendency. There will be familial tendency in Robertsonian translocation type of the Down syndrome. Okay, and now QRS, S for small, that is the small mouth, a small hand, and the small mouth, a small head. Head is also small. Okay, everything is small, as well as the seizure. These patients are suffering with the seizure. ST, T for there is patient will be hypotonic, there will be hypotonia, as well as the from the T, okay, MST, UV, U for unexpected death of the patient at the age of 50 to 55 years. UV, V for vision impairment. W for wide space. There will be wide space in between the grade 2 and the second 2. There will be wide space. Okay. UV. W X, there is nothing from the XYZ. Okay. So A to Z problem is there. Now coming to the investigation, we do CAT. CAT is the chorionic villus biopsy, and the A for amniocentesis, and the T for triple screening. In the triple screening, we do alpha fetoprotein level and the HCG level, as well as the unconjugated estriol level. Okay. In the Down syndrome, level of the alpha fetoprotein will be down. In down, it is down. Okay. And now the treatment is according to the symptomatic treatment will be there, like in case of duodenal atresia, omphalocele, atrial septal defect, surgery is advised. In case of ear infection, pneumonia, antibiotics given. There is also a speech problem, so speech therapy, occupational therapy, in case of speech problem and the hypotonia. In case of hypothyroidism, thyroid supplement should be given. In case of suffering with a seizure, then anticonvulsant given. Okay. Now these are the treatment of the Down syndrome. This syndrome is discovered in 1866 by a British physician called Langdon Down. That's why this is known as Down syndrome. Thank you.